Jazakallah khair, Hadisa. Inshallah, the first question will start the topic. We don't have much time. So, for Dr. Sablaban, can you speak on the science of depression, inshallah?
Yeah, absolutely. Yes, assalamu alaikum. So it's a complicated discussion because a lot of people try to say that depression is like diabetes or like breaking your leg or something like that. And it's really not. It has a lot to do with the psychology of the human being. It has to do with their upbringing. It has to do with where they're from. It has to do with their experiences. But there is a large medical component. Um, you can't have a lot of objective data about the medical component because depression looks very different for people suffering from depression. Some people, they've got a lot of anxiety. Some people, they're very melancholic. They don't get out of bed. And in some cases, depression can be very reactive. But I'll give an example, I think, that can liken it to an endocrine disorder. So there was an observational study where there was a specific enzyme. It was a tryptophan kinase enzyme that was isolated, and they took 97 people with that enzyme as the control. That it was functioning absolutely fine, and I don't believe there were any cases of major depressive disorder in that population. And I think they took maybe another 198 where the gene was knocked out or the enzyme was defective. I can't remember the study exactly, but that actual group of people had, I think, not 20 or 25 had depression, had major depressive disorder. So there's absolutely a medical component to it. What we also know is that people with major depressive disorder and people with generalized anxiety disorder, they have lower levels of serotonin, which is a neurotransmitter that the brain uses for a lot of cognitive functioning, for a lot of functioning in general. It's involved in a lot of neuronal cascades, but we know that lower levels of this is associated with depression, and it's associated with depressive behaviors in animal models. So what does that mean? It means that, say, a hamster that has a particular locus for serotonin, this neurotransmitter knocked out, won't partake in activities that you would expect. So it'll eat less. It'll be less likely to run on the wheel. It'll be less likely to participate in socializing activities. So this translates really well into the human clinical population, because the hypothesis that serotonin is related to depression is substantiated or is backed up by the fact that SSRIs, or serotonergic medications, so antidepressant medications, work. Now, the effect size after the first medication isn't super large, but after trying two medications, so you try a medication for the full regimen and then you try another medication if that's ineffective, and that would be a 6-week trial and then another one, you get a statistically significant remission of symptoms. So is depression a medical illness? Partially. Does depression have to do with the psychological upbringing of somebody? Absolutely. Living in the Western world and living in an age where we have a lot of stimuli, right? So everybody's connected to social media. Everybody's looking at what everybody else is doing. People are looking at things they don't have. 100 years ago, you didn't really know what you didn't have. You just lived in your world, like my parents lived in the Middle East, or my grandparents lived in the Middle East, and you just saw your village. You saw what you had, so that's what you saw. You didn't see the entire world and the opulence, and you didn't have this constant desire to compete and compare. You did, but to a lesser extent. So, and that's one of the reasons why depression is on the rise. So it's gone up 35% in the last 10 or so years, 10 to 15 years. And the Muslim community is part of the Western community, so it also has that effect.
Thank you so much. This question is for Brother Tareq. Can you elaborate on the taboo of depression in Muslim communities, and is it cultural or religious?
Jazakallah khairan. So, Bismillah, alhamdulillah, wa salatu wa salamu ala rasulillah wa ala alihi wa sahbihi wa man wala. It's a great question. So, the taboo, and is it cultural or religious? So, there's a lot to unpack there. And a part of it does go back exactly to what Dr. Sablaban was talking about, which is the fact that we don't understand what depression even is. And that's neither culturally, like both in the cultural spaces and the religious spaces. And we suck at drawing the line between cultural and religious motivations for things anyway. Particularly when we're in the West, it becomes very easy for these things to be merged. And it's difficult sometimes to separate. And that's not necessarily even a bad thing, right? I mean, sometimes we position culture as just being this thing that is different from religion, antagonistic to religion, etc. And the reality is Allah subhanahu wa ta'ala has left areas within how we understand how the religious is practiced. He's left it, you could almost say, open to flexibility in different cultures, right? Where there's some things that the details of how they are implemented, and one, you know, we talk about concepts like urf, right? So understanding the common culture and how things are commonly practiced in an area. This is actually one of the ways how Islamic law is understood in terms of how it's implemented. So this is very commonly seen in the context of marriage, right? Where there's certain practices that are, am I breathing into it too much? Okay. In the context of marriage, for example, urf is one of the ways, urf is like knowing the common practice amongst the people. This is how you can even determine some of the fair expectations from one spouse to another, of like what is from the common culture. So I say this to say that our culture plays a role in how we understand our religion. So it's not just like an arbitrary separation of is it this, is it that. These things are somewhat meshed in. So let's expand this a little bit more. Let's take a concept like what is masculine? What is feminine? Is there a way for us to only understand this religiously, or is there a cultural component to this too? Right? We know this in practice, that from one culture to another, one thing that might be perceived as masculine might be perceived as feminine in another. I remember one of the first times I was visiting my family in Syria, and my cousin, my male cousin, held my hand casually as we were walking. And I'm like, yo, like, what you doing, man? This is weird. And it's normal. And then I saw like other people doing it. In some cultures, this is normal. It's like a completely fine thing to do. Is there something that I could say religiously to assess what that is or what that isn't? No. So I say this just to say, is it cultural? Is it religious? These things are difficult to fully define authoritatively. Say, this is what it is. Okay, but there is a taboo about depression, and a part of it comes down to our own disconnect from our tradition. I mean, it's a pretty common talking point now that the first psychiatric hospitals in human history, as far as we could tell, seem to have been started and established in the Muslim world. Muslims were amongst the first to say, hey, there are clearly psychiatric conditions and we have to figure out how we could treat them. You had some cultures and some religious traditions who would say, oh, these people are all possessed. We need an exorcist, we need this, we need that. Whereas Muslims, although we did have an understanding of concepts like, how, let's say, things could affect somebody and there might be a need for, there could be things like jinn and this and that. But alhamdulillah, we did not have that simplicity of some other faiths where we thought this was everything. We were actually quite nuanced in this. But unfortunately, as sometimes, human beings grow and they interact with other cultures and they adopt practices and they adopt understandings, some of us came to a more simplistic take where we started to think, oh, it's this and it's that. And so there's definitely a taboo. A part of it comes down to not being able to identify what is depression and what is not. A part of it comes down to this feeling of depression is a weakness, right? It's a weakness of faith. It's a weakness of a connection to Allah subhanahu wa ta'ala. And we'll elaborate on this a little bit more, inshallah. But there's been lots of studies that show what you might say the positive mental health or the positive psychological benefits of engaging in religious practice and spirituality. And this is non-specific to just Muslims. This is just the general concept of spiritual practice, understanding your purpose, understanding having a meaning in your life, connecting with a greater power. These are all things that when they've been studied, it's been shown to have positive effects on people's mental well-being. Now, what if we know that Allah subhanahu wa ta'ala himself tells us about the Quran, that in it is a healing for us, right? There's a shifa. When we know all of these things that Allah subhanahu wa ta'ala talks to us in the Quran multiple times about the benefits of connecting with Allah subhanahu wa ta'ala, that it gives you comfort and it gives you, that those who are distant from the practice of salah, for example, will have anxiety and anxiousness. So these aren't clinical, assessments that we're giving, but we have precedent within our tradition from Allah subhanahu wa ta'ala and His Messenger sallallahu alayhi wa sallam, that engaging in certain practices, including religious worship, could be a means of, you could say, improving yourself and protecting yourself and developing a stronger sense of mental well-being and mental health. However, that is still different from preventing something like mental illness, right? And then the distinctions of how we define these things, they're difficult, but it's not impossible, and it's hopefully something that we can cover a little bit more, inshallah.
Inshallah, the next question. The next question is, how prevalent is depression in Muslim communities?
So in the Western world, it seems to be that there's a lot of conflicting data. So there was actually an article that was released in JAMA Psychiatry done by the Stanford Muslim Mental Health Organization, which is an organization that does a lot of good work on the West Coast, that placed depression as being slightly higher in the Muslim community than in practicing Jewish and Christian communities in the United States. Now, the Muslim community is broadly more practicing in the United States, so that's also very important to take note. But it's hard to get actual numbers because that study was quite flawed, actually, and criticized heavily. So it looks like, and what I would assume is that the rates of depression are substantially less in the Muslim community than they are in the secular Western community, based on data that we've had for decades about what depression is in the United States versus countries abroad and versus ethnic minorities in the US. So give you sort of a rough estimate. Completed suicides is probably the easiest way. I mean, this is a very, very sensitive topic, but if you take the Caucasian, say, community, Caucasian males, somewhere around 40 per 100,000, if you take sort of the average over the last 20 years. And if you took, say, African Americans or Latin Americans, and then subsequently the data that we have on Middle Easterners, it's closer to 20 to 25 per 100,000. So that's half rate. Now, that doesn't mean that major depressive disorder isn't as prevalent in Muslim communities or in minority groups as it is in the sort of white Anglo-Saxon Protestant community or in the more secular Caucasian community. It's very, very difficult to study. So the DSM, which is basically a medical manual for diagnosing depression, is based on statistics that have been gathered over decades from a very specific population in the United States. And I can tell you, I don't fall into that population. My parents were both refugees from Palestine, and I don't think the majority of people in this room fall into that population either. So defining depression medically for our communities is actually very difficult. I would assume that the generations growing up right now probably have similar rates of depression as their American or their general counterparts. And that's because the gap between minorities and Caucasians in the United States year by year has decreased. Actually, there's been a transposition for the first time in 2020, I believe. African American children were actually more likely to attempt suicide than their Caucasian counterparts. So every year, the difference between folks that live in this country long enough and get homogenized into the culture shrinks. That's the best answer that I can answer. Now, as far as Muslim communities abroad, it's very difficult because there's very poor data. There's poor data in the Middle East. I'm sure there's poor data in Pakistan and in India, and so that's a difficult thing to discuss. But I would say, for the purposes of function, I would say that they're very similar, particularly in the younger generation, to our Western counterparts, whatever Western means. We're all Western.
So for these questions, we have like both of the speakers speak, and then also before you guys go on, can you like define depression for like the average person, like what would you qualify as depression? And also, can you guys talk a little bit about it because it's some experience?
Oh, sure, yeah. I mean, depression is essentially. Again, its definition is actually very abstract if you're looking at this, but let's work within the confines of the DSM. It can be feeling depressed, so in other words, not wanting to do things, which is something we call anhedonia. So you like to play basketball, you don't want to play basketball anymore, you don't want to hang out with your friends anymore, you don't want to eat anymore, maybe you stop, if you're a religious Muslim, you stop being as into getting up for salah on time, you just feel like something's weighing you down, having a hard time concentrating. A lot of people get prescribed stimulants because I can't pay attention in school. I have ADHD, but they're actually, they're morbidly sad because school is difficult and life is difficult. People become irritable. Sometimes people feel a sense of guilt or shame based on things that they've done previously, or possibly based on nothing at all. We live in a country where we're very much separated from society and looked on as though we're a little bit different. When you're fasting and nobody else is, and people may judge you for going to pray. All those things add up. And then sleep disturbances, either having a difficult time going to sleep, staying asleep. A classic sort of issue with depression that a lot of people face, and this is probably a biological issue, which is what I'm bringing it up. You wake up well before Fajr, sort of feeling distressed, and you're uncomfortable. It feels like there's a pit in your stomach. That's sort of a universal depressive symptom. So that, and then thoughts of not necessarily suicide, but nihilism. I wish I didn't exist. It would be better if I just wasn't around. That's not the same as, wanting to go end your life, but it's a universal human feeling that happens sometimes. And a lot of people get ashamed of it, even though there's no real reason to be ashamed of it. Life is difficult. People have nihilistic thoughts at times, but that's basically what we're talking about when we're talking about depression.
Thank you so much.
Jazakallah khair. So as I give my answer here, I'm just going to be like looking at Dr. Sablaban and just being like, am I getting it right? Because I agree with everything Dr. Sablaban said. And then now I guess what I'll try to do is give my definition of how I understand it somewhat in practice. And then I'll also kind of give, I guess, the answer to, or a little bit of additional things to do with the question. So I don't think about depression as something that like you either have or you don't have. The way that I think about it is depression, if we're going to bring it back to like the way that we understand its root, sadness, it's something that we are all promised that we will experience sadness and difficulty in our life. And then how long that sadness lasts and how much of an effect it has on you is going to result in some categorization that a clinician or that a physician might apply to you. Is that fair? Yeah. So the reality is there's a lot of different factors that can affect your sadness, right? Or that can play a role in your experience of sadness and how long it lasts and how it interacts with who you are. There's psychological factors, there's social factors, there's biological factors, there's so biological genetic factors, and there's spiritual factors. All of these things are going to play a role in what will make you sad, how long it will make you sad, and how much that sadness is going to affect you in your life. I say this because depression, many people will talk about depression like it's a thing that other people have and not a thing that we will inevitably at least brush with. So it's almost a cliche now when people be like, I've experienced depression, right? And people like celebrities will say, they come out and they share that I have experienced depression at some point in my life. And it's like, oh, it's relatable, they're being vulnerable. But it's almost a cliche because, we're almost all going to experience depressive feelings, right? Or to go through a depressed state emotionally. And we look at the example of Rasulullah sallallahu alayhi wa sallam and Aam al-Huzn, the year of sadness. Now I say this with caution because as much as we want to relate to the example of Rasulullah sallallahu alayhi wa sallam, we should also be cautious with trying to apply a clinical diagnosis to Rasulullah sallallahu alayhi wa sallam, as well as, honestly, anybody that you are not qualified to diagnose or who has not come to be diagnosed. That's the job of the experts, alhamdulillah. But when you know that there's an entire year of Rasulullah sallallahu alayhi wa sallam's life that is defined as Aam al-Huzn, the year of sadness, there was many, many, many sad events. And the result at the end of that was Allah subhanahu wa ta'ala taking Rasulullah sallallahu alayhi wa sallam on that journey of Al-Isra wal-Mi'raj, right? The journey to Jerusalem, to Masjid al-Aqsa, and then into the heavens, where Salah is prescribed and where Rasulullah sallallahu alayhi wa sallam has this dialogue with Allah subhanahu wa ta'ala and he meets the prophets and all of that. It's like a gift to Rasulullah sallallahu alayhi wa sallam after a year of difficulty and pain and loss. The loss of his uncle who was his strongest supporter, the loss of his wife Khadija radiallahu anha. So there was a lot of difficulty. And let's just say this, Dr. Sablaban, if somebody comes to you and they said, I have experienced the loss of the closest people in my life, and these sad events have been happening to me for 12 months, Would you say that there's something to relate to on that level from somebody who might feel like they're depressed?
Yeah, it's related. Yeah.
Yeah, it's definitely relatable. I say this to say I'm less interested in putting a specific label and more about understanding the human experience that binds us all. And that means that how prevalent is depression in Muslim communities? There's my answer. It's everywhere. And the more that you know this and that you're able to recognize this, it's not about saying, wow, everyone is so depressed, but rather it's about saying, hey, listen, if this is something that I'm going to eventually brush with, then being able to identify it might also help me manage it once it comes forward, to make sure that to the best of my ability, I could stop it from getting too bad, and that I'm also open to different forms of treatment depending on maybe how much it's affecting me, or maybe my unique factors biologically, psychologically, etc.
Let me just tag on.
Yeah, absolutely.
Yeah, no, absolutely. It was very eloquently put, actually. Yeah, the objective, and just to sort of talk about the psychiatry angle of things, the objective actually isn't to pacify human emotion at all. We will all feel depressed with a lowercase d. We'll all feel sad. Everybody's going to cry. Everybody has parents, and eventually they, inshallah, depart to the next life. And that's the context of human existence. We have a lot of suffering. I'm an inpatient psychiatrist. I usually see very, very severely sick people. And when we call, or when the Western medical establishment or DSM or the American Psychiatric Association defines depression, it's defining something that meets a threshold to make somebody dysfunctional. So aspects of life start to suffer in a way that is viewed as abnormal. So there are actually other diagnoses like adjustment disorders and adjustment reactions where you're not treating with any medication. So the objective isn't like, oh, come to me if you're feeling sad, I'll give you some pills and you'll not feel sad anymore. And actually, I would encourage people to see therapists before anything. But if something is severe enough that now you failed 2 classes in a row, you don't know what's going on, you don't know why you're not getting up, you don't know what's happening, you've lost a lot of weight, that's when you kind of go into the ballpark of getting medical help. That's when that becomes relevant. Doesn't need to be that severe for you to get an assessment, get an analysis, but just to contextualize what brother was saying.
Thank you so much. Yeah, especially with so many youth in here, just keep that in mind. If there's an issue, please get some help, talk to somebody, right? Just don't keep it bottled inside, inshallah. The next question is, how can we lessen the stigma regarding mental health, particularly amongst the older generations, and make it something people are more willing to talk about and reach out for help when they need it?
Okay, I can answer the older generation's question a little bit. It's not the same answer that you would give how you lessen the stigma regarding mental health for the younger generations. For the older generation, I'll say that if an emotion is suppressed, whether or not it's a pathologic emotion or it's a non-pathologic emotion, if you suppress an emotion, it'll come out some other way. I remember once I was talking to a group of youth, and I talked to people in confidence, and they were Muslim youth at some mosque somewhere in either Michigan or Illinois, and I asked people, how many people smoked weed to cope with life? Like everybody's hand went up. Like, like I'm talking, like this is a group of Muslim youth who go to them. So you're talking about the number of people that have decided to spend a Saturday going to the masjid. So we're already talking about a group of people that has buy-in to the Islamic religion, that has buy-in to the aqidah and the deen, and that's the result. Okay, so if you belittle the circumstances of existing in this world and belittle treatment, belittle therapy, and I don't mean belittle diminutively, I mean if you view it as something that you can just sort of brush along, treatment will be sought elsewhere, whether that's with drugs and alcohol, whether that's with partying, those things are things that have long-term ramifications. As far as lessening the stigma, I mean, Brother Tareq said it's an inherent part of existing that is echoed throughout our liturgy, that's echoed throughout the hadith, that's echoed throughout the Quran. I mean, there's a statement in the Quran where somebody says, Ya laytani mit, right? In Surah Maryam alayhi salam says, Ya laytani mit, because of the circumstance that she's in. That's a woman chosen from amongst mankind. SubhanAllah. So That's how you lessen the stigma. You reintegrate the fact that these emotions are emotions that are defined and that are assessed and that are discussed at length in Islamic dialogue, and that our scholars have written volumes about this. So I think that's how you lessen it amongst the ummah.
Thank you. And once again, Brother Tareq, from the older generation, how
Yeah.
can we,
Fantastic. So, boy, there's a lot to say here. I'll circle back to the point about the older generation. First of all, when it comes to lessening the stigma, of course, talking about it. But let's just rewind a little bit to like why that stigma is there, right? There's the idea that if let's say nobody has to raise their hand here, but think about this for yourself. Have you ever experienced a period in your life where you felt, let's say, deeply sad for a prolonged period of time? Okay? And I'm gonna leave the prolonged period undefined because it's irrelevant to me. Now, I don't care if you call this depression or not, okay? But when we talk about depression, we're talking about that. That's what it is. If you've experienced that, then this topic should be relatable to you. And the problem is we have sort of like an otherization when we talk about depression. It's like, oh, those are like different people. That's not like normal sadness. That's like people who go through this or that or blah, blah, blah. They need medication. They don't practice faith. They might, and again, the word like trigger warning is used sometimes, but these words, for anybody who actually understands the weight of these types of experiences, talking about them casually could be difficult. When we talk about something like suicide, right? Somebody might be like, oh no, depression is the type of thing that would make somebody commit suicide. I never got to that point, so I wasn't depressed, right? Another aspect of it. Now you might think, no, I don't think those negative things. Well, if somebody told you, I'm depressed, isn't there sometimes a part of us that might be like, well, like, why are they depressed though? Like, was there something that they could have done better? Maybe if they did this more, if they did that more, maybe they weren't. So we have to unpack what the negative things that we think about people who go through these types of experiences. Mostly because it's irrelevant, because the reality of human experience is that we are flawed creatures. We are flawed and we make mistakes. And you are flawed today and you might not be depressed and sad today, right? And you will be flawed tomorrow and you might be depressed or sad tomorrow. Why is it that we only highlight these flaws or imperfections when there is that feeling of sadness? Does that make sense? Does that make sense? Maybe this will make a little bit more sense. Raise your hand if you've experienced the loss of somebody who you cared about and you regretted maybe, or not you regretted, but maybe you wished, I wish I did something for that person more. I wish I spent more time with them. I wish I talked to them. I wish I did this. Raise your hand if you've had that experience of somebody passing away and wishing that you could have done something more with them or for them, etc. It's a pretty common experience, right? Sometimes we beat ourselves up about that. Like, man, I wish I did that. I wish I did that, blah, blah, blah. You're only beating yourself up for it now because of the other sadness that's there, the other things. The same circumstances that were valid for you a few days before of like why you weren't able to talk to them or do that, they're still valid today. The reality is we're not always going to be able to do everything that we want to. We're not going to be perfect. So we will always have vulnerabilities and weaknesses in our lives that, if a tragedy befalls or a difficulty befalls, it could make it so that depression and deep sadness can fall upon us. I say this not to say that means it's okay, there's nothing that we could do, we should be defeatist. No, but rather just to acknowledge that this is part of being human. So just because somebody falls into it, it doesn't mean that we should start fixating on what they could have done differently so that they wouldn't end up there. Every day, we're trying our best to walk with Allah subhanahu wa ta'ala, right? Does not mean tragedy and difficulty won't befall. So how can we lessen the stigma? I would start on the first, everybody, the wide scale of society. We should really question why it is that we have negative thoughts, first of all, when people share these things. Second of all, we should realize that understanding why somebody fell into these circumstances mostly makes sense for the people who are helping this person try to improve. Not for the masses to sit and assess and diagnose what a person went through. Okay? Now, the other thing I would say is talking about it and being actually open to talking, and this is one of the reasons why events like this are important. Because if one person leaves this event and then they go to their friend, one of their friends maybe, or a group, and they say, I've been feeling really sad recently. then that's a win in my book of like this event was successful. Because it's really difficult sometimes to create the circumstances where it's socially acceptable to talk about these emotions. So it's necessary that we actually open these, and I say this as like, I'm directing this to the youth. It's very difficult, man. And I mean, right now, of course, I know that there are sisters listening, but right now I'm looking at a room full of guys. Man, I know it's tough, man. Talking about your feelings is tough. And in some cultures, it's even tougher. Like to be able to say, yo, like, I'm really sad today, man. And have somebody who's able to receive that, not be weirded out by it. It's really difficult. It's putting yourself in a position of vulnerability. So how can we lessen the stigma? Well, I mean, we should also try to lessen, let's say we have to be more open to vulnerability. And that's scary. Like we have to be open to talking about these things and opening up with our friends, with our family, with our trusted people, our mentors, our teachers. We need to be open to talking about this stuff and being vulnerable. That's scary, but it's far less scary than the alternative of suppressing it for a very long time and what that'll do to you. So take that as like the go ahead from me right now. After this event, if you're going through something, be willing to talk about it. A little bit, just be like, yo, I'm sad. I don't really know why, I don't know how, but I'm sad. This is how I feel. And just bring it out there. It's less scary once you actually bring it out. Because they grow and become heavy thoughts the more that we suppress them. So that's the first thing. And then with the older generation, what I would say is there's a lot of reasons why I think it makes sense why the psychology of the older generation is a little bit different than the psychology of the younger generation. And guys, just imagine this, and this is to the youth, because I think it's mostly predominantly youth here. Imagine leaving your family, your country, your people, your culture, all of that, and putting yourselves in a very vulnerable place where you have no status, no support, no this, no that. You might have a job, but man, you're in a whole new world. You blew up your life and you're just trying to provide a good future for your family, for people back home, etc. You did all of that. If you become a bleeding heart that was opening up to everybody and crying every day about your feelings, at some point people are going to stop listening to you because, you know, the older generation also went through a lot of difficulties. Some of them much more serious difficulties even than we go through. It's not an issue of comparing, right? But I think about some of the things that, let's say, like my father went through. I'm like, man, if like he could write books and books about sadness. He processes it in a way that makes sense to him. Some people maybe they process it in a way that maybe it ends up coming out to the youth, and maybe it ends up there's emotional neglect, or may Allah protect us with abuse or something like that. So we're not saying justify how they decided to cope, but they've been dealing with it for a long time. And from the youth side, I think having a little bit of patience, the difficulties that our parents' generation went through, and then from the older generation, I think also acknowledging that the way that you coped with things is not going to be the same as the younger generation are coping with things. And the good life that you've tried to provide for them, hopefully that puts them in the position that they can understand these things, not have to suppress them like you had to suppress them. And maybe the fact that they're able to cope with them in a healthy way will result in a state of emotional and mental well-being and spiritual well-being that will allow them to even contribute to a greater level than you did, that allow them to get to an even better place. So just because you had to go through certain things doesn't mean that it has to be written for them as well, or that what they're going through is less than. You're trying to pave the way for them. So we ask Allah to give us patience on both sides. There's a lot to unpack on this level, but I hope we touched some of them.
Thank you so much. Yeah, absolutely.
MashaAllah, thank you for that. Just to elucidate or to elaborate a little bit for the youth too. You absolutely want to open up, but to your most trusted confidants. So your parents, your brother, your sister, not TikTok, not Facebook. I don't even know if people use Facebook anymore. Not Instagram, because that has its own associated pathology that breeds a completely different kind of illness. So you really don't want to open up the floodgates. You want to tell the people that are closest in your life who can directly intervene, and be selective about it, because it's a vulnerability. It's called vulnerability because it does make you vulnerable in certain situations. And I think I've seen sometimes it swing the other way when people are like, yeah, let me just tell everybody, make a post, and then that just gets worse and worse and worse, and there's a spiral. I just want to say that.
Thank you. And that's very relevant these days.
Yeah.
I definitely don't endorse crying to TikTok.
Yeah.
The fourth question will be, can you give us any advice on how to cope with depression, anxiety, heartbreak, loss, etc.? Practical tips and methods and resources we can use and people to reach out to.
Let the brothers do it.
So I think all of these things are very different. It's good, I think, that we want to cope with all of these things. But I guess in that spirit, I'll give a somewhat general answer, but we can always go into maybe more specifics later. The first thing that I'll mention is a point that Dr. Sablaban already said, which is go to therapy. Therapy is good. The second thing, and this is like the I guess the disclaimers that I'll put like maybe 10 asterisks after therapy. The reason why is just, first of all, I understand that not everybody has access to therapy. Sometimes it is very difficult to access financially and insurance and all that fun stuff. It's a mess. And so try your best when you can. And if you can't go to somebody in that way, then somebody who is trusted, somebody who's a spiritual example, an elder, somebody who knows that field, that industry, that's their area of expertise. And this is, by the way, one of the blessings, alhamdulillah, of communities, right? One of the blessings of communities like this is that you can talk to people who are older than you. And this is maybe a good general life tip. Talk to people who are older than you when you need help. It'd be like, hey, like, I don't know who knows this, but I'm looking for somebody who does A, B, C. They might be able to connect you to somebody. You might not be able to get a therapist the traditional way, but they might be able to connect you with somebody who will give you some of their time. The second thing is that if you're trying to seek therapy, understand that you might not find the perfect fit between yourself and the therapist immediately. I remember telling one of my friends who was going through some difficulties, and I was like, listen, man, you should see a therapist. He's like, I did talk to a therapist and they sucked. They did nothing for me and I just felt like I wasted my time. I'm like, okay, that's very possible. Therapists are not prophets. Therapists are not mind readers, and they aren't divinely guided, right? They're trying their best with their backgrounds, and they're human beings who have their own biases and their own shortcomings. But the process, what are you trying to get with therapy? It's just a space for you to let out your thoughts and your let things out and be guided in how to think about them in hopefully a healthier way. And the therapist might be able to tell you, hey, look, this is something that requires more serious treatment or more serious care, and they'll be able to direct you in the right direction. So it's often going to be better than talking to somebody else because they're trained to be able to respond to you in a meaningful way. The first one might not be a great experience. Maybe the second one will be a great experience. Maybe the third one will be. Maybe the fourth one. Maybe you're expecting too much from the therapist, that they're going to fix all of your problems. That's not necessarily what they're going to do for you. So being open to talking to people, I think is definitely important. The second thing is acknowledging that there is a spiritual role, and spirituality plays a role in how we cope with depression, loss, difficulty, etc. And it's not just when the difficulty befalls you. Spirituality has a preventative role as well, not preventative from like mental illness, from the perspective that, oh, if you do A, B, C, D, you'll never become ill. But what you're doing is, first of all, when you're building healthy habits spiritually with Allah subhanahu wa ta'ala, what's going to happen if you pray, let's say, every day, and you read Quran, you have a daily wird, you do your adhkar, etc. What's going to happen when a difficulty befalls you? When Allah subhanahu wa ta'ala, the thought of Allah subhanahu wa ta'ala is more salient in your mind, when it's something that is closer to like your immediate thought because of your actions and your practices, what's going to happen? It's going to help you frame the difficulty when it befalls you in the best way that you can, right? Does it mean that the difficulty will not befall you? No. But you might be able to have a stronger or a healthier way of processing it because you've had Allah subhanahu wa ta'ala in your mind as well. And the third thing, and this is what I'll pass it on to Dr. Sablaban, is just to understand that, of course, difficulty is a promise from Allah subhanahu wa ta'ala, and nobody was tested more and given more difficulty than who? Rasulullah sallallahu alayhi wa sallam, and the prophets, and those who are like them. Allah subhanahu wa ta'ala, لا يكلف الله نفسا إلا وسعها. Allah subhanahu wa ta'ala does not burden any soul with a burden greater than it is capable of carrying. This is a promise from Allah subhanahu wa ta'ala. Of course, the prophets are going to be capable of carrying the heaviest burden. They are the most beloved to Allah subhanahu wa ta'ala. But what does that tell you then? If you see difficulty befalling you, Allah subhanahu wa ta'ala has something for you. What that is, I can't fully define, but it is something that you will find on your journey to Allah subhanahu wa ta'ala. when immense difficulty befalls you, you're following in the footsteps of the prophets. It's not to say that you shouldn't also, I'm not going to give that advice to somebody who says, look, man, every time I drive, I crash my car. I'm like, look, bro, maybe you should reconsider, what you're doing on the road if that's happening all the time, right? So don't take what I'm saying too literally, right? But let's say you find in your life, difficulties are befalling you, things that are out of your control, things that are very difficult to manage. I mean, heck, Rasulullah sallallahu alaihi wasallam, look how young he was when he lost his parents, right? His father, before he was even born. He was born into difficulty and pain and loss. Is there anything you could have done to prevent that? There's a reason why there's like the trope of like the orphaned hero who overcomes these difficulties and becomes a superhero, right? It's like literally every single superhero. What is their origin story, right? But it's not just related to superheroes. Look at the prophets. Look at where their journey started. It's something that is in the psyche of our culture. We actually understand that immense difficulty prepares you for immense responsibility. Not trying to go to Spider-Man on you, but it's important for us to remember that. لا يكلف الله نفسا إلا وسعها. When difficulty befalls you, know Allah subhanahu wa ta'ala knows that you are capable of carrying it. So find the steps that you could take along the way, and that could include as well therapy and seeking professional help as a means of continuing on your journey to Allah subhanahu wa ta'ala. And unique difficulties will give you unique experiences, unique insights, and unique ways of connecting with Allah and serving Allah subhanahu wa ta'ala, as well as serving your community and connecting with the world around you.
We've got time?
7:30.
Okay. 20, half an hour? Okay. All right. Yeah, no, mashallah, that was great. Yeah, these are all different things actually: depression, anxiety, heartbreak, loss, practical tips and methods. So, subhanAllah, I'm usually not, I talk to Muslims frequently, but usually when I'm talking explicitly about this sort of thing, I'm speaking to a very secular audience that's either like medical students or residents. But first, I'm sitting in a masjid, there's a lot of ritual to Islam, right? We have sha'air, but you need to remember what you're doing it all for. You're doing it for Allah subhanahu wa ta'ala. And I think that was emphasized. That's an advantage that you have. You have as a Muslim. You have as somebody who has a line to be able to speak to Allah subhanahu wa ta'ala, to have him hear you. And irregardless of whether or not you see the fruits of that immediately, it's something that you should utilize. So if you do feel depressed, if you go through a breakup or a divorce, if you're anxious about a test, if I'll make it easy, if somebody loses a loved one, that should be what you make a beeline for immediately. You should go pray a couple of rak'at and hold tight to that, assuming that your connection is good, inshallah. And even if it's not, there's a looming feeling of shame and guilt that a lot of people have, and that's not part of it. That shouldn't necessarily exist. The idea that maybe you don't pray, so you can't have a relationship with Allah subhanahu wa ta'ala, so you can't go pray nafila, so you can't start praying today or tomorrow and being able to deal with depression or anxiety or heartache. Now, as far as dealing with things that are happening actively, there are lots of techniques to deal with things that are happening actively. We often just choose the incorrect ones. So when all those young men raised their hands and said, yeah, we smoke weed, that is a coping mechanism. It's a terrible one, but it's a coping mechanism. I go party, yeah, it's a coping mechanism. It's a terrible one. There are lots of things within the realm of Islam and secular things that are good and beneficial for us, that Allah has provided for us to be able to cope with depression and anxiety, whether it's working out, whether it's getting into the arts. There's a lot of beautiful art within Islam, like taqteed and the beautiful calligraphy that you can occupy your time with to be able to move on from certain things that have happened. Great pain often brings great inspiration. And those are all things and resources that you should use. Yeah, a lot of therapists suck. It's a eclectic variety of people that go into the field of mental health, and a lot of psychiatrists are terrible too. Honestly, I'm a psychiatrist. I'm just saying that candidly. I think I usually say that while I'm teaching too, right? I'm like, oh, these guys all suck, like they're terrible. But the reality of it is, if one is terrible, it doesn't mean that you don't go to another or you don't try again. There are a couple of institutions. There's something called Iman, which is sort of an inner city institution that can usually try to connect people to Muslim mental health professionals. There's a Muslim mental health conference I'm not terribly crazy about, but there are people that link up to that sometimes. So you can get a therapist, or you can find a directory of therapists that are more knowledgeable of your background, because sometimes the wrong therapist will say something that is completely contradictory to what you want to do, to what your aqidah or what your inner religious desire wants, and that breeds conflict. So that can happen from time to time. And the reality of it is, if something is severe enough to warrant medication, I mean, when I started talking, I described something that was essentially a deficiency in an enzyme, or an autoimmune illness in an enzyme. I could have been talking about an endocrinologic disease. I could have been talking about lupus. I could have been talking about anything. Nobody goes to the doctor and says, I really shouldn't take my metformin. I feel like I'm weak. It's so if somebody who's good characterizes and works with you and says, we've done A, B, and C, you're doing everything you can, let's do a trial of something, gives you all of the potential side effects, says this is what might happen, keep an open mind to it. There are lots of religious people who need things like this from time to time, and for the most part, the medications that a fair psychiatrist prescribes aren't addictive medications. Majority don't have any withdrawal symptoms. You can start and stop. You shouldn't start and stop, because you should actually give them an appropriate trial if you truly have a clinical illness. And I think keeping an open mind to that, and all of the things that you can do before that, also keeping in mind that you are a Muslim, alhamdulillah, and you have that avenue, that is an advantage for you.
MashaAllah, very beautifully put. Your last question will be, how should we approach someone who we suspect is struggling with mental health issues?
Bismillah. I don't know if it's just me, but I feel like every single one of these questions is like deserving of a conference, basically.
Yeah,
So-
they're very vague. They're
Yeah,
very broad. Yeah.
Very broad.
Yeah.
So maybe it's a good time to reiterate that the point of this conversation is not necessarily to speak, comprehensively, but to get our minds going and think and reflect on that. How should we approach someone who we suspect struggling with mental health issues? Okay, let's rewind a little bit. How should we approach people in general if we want to help them, right? I would say everybody is different, right? Everybody is different. So even if you think, oh, these are two depressed people, or it's all depression, everyone is different. And I think it often comes up in the conversation on like how to do da'wah, right? Or how to call people towards goodness. How do we do this? It's not a popular, or let's say it's not a well-liked answer to say, you might not be able to do anything for them right now. Your ego wants you to feel like, or it's not ego, sometimes it's something else. Sometimes it's maybe more well-meaning. But sometimes we want to resolve it immediately. We want to say, like, what are the words, what are the magic things that we could say right now to make sure that this problem is taken care of, right? Sometimes it comes out of sincere love and devotion and interest for this person. Sometimes it comes because we're uncomfortable with what we see, so we just want to get it dealt with. So what I'll say is, be this person's friend first. Like, be the right person to talk to them about something that's so sensitive. And it is, again, to go to the idea of al-amr bil ma'ruf, encouraging people towards goodness, wa nahy al munkar, forbidding evil. When you're trying to call somebody to Allah subhanahu wa ta'ala, it's a matter of the heart, right? It's a matter of iman. The heart is very sensitive. It's very sensitive. When something is sensitive, you don't just come like in the middle of the day to a person who's out and you just go, hey, this is what you need. This is the answer. Part of them is not gonna listen to you because they might think that you don't understand them and their story and their background, even if you're giving great advice. A part of them might just be off-put by like, who does this person think they are, etc., etc. Sometimes they've heard the advice 1,000 times and you're just not the right person to deliver it to them, or it's not the right time for them. So there's a lot of variables that go into how to approach somebody, but I would start by make sure that you're the right person. have a meaningful relationship with this person. And if you're not the right person, maybe find the right person, right? So maybe I noticed that my friend Mahmoud seems like he's very sad, uncharacteristically sad. It's one thing for me to say, I recognize this, therefore I should handle it, as opposed to being like, yo, Mahmoud is really close to Ahmed, so I'm gonna tell Ahmed, hey, listen, I noticed something about your friend. Somebody should check up on him. Somebody should talk to him. And maybe Ahmed's not the right person, but maybe they'll know somebody who they could direct to. And sometimes it might not be a direct advice. Maybe you want to bring them to something like this, right? Or maybe you want to bring them to the masjid, or you want to have them join you for something that might uplift them. So you might not want to handle it directly. Maybe you want to handle it indirectly, right? Because maybe you think if you handle it directly, they might get defensive, or they might get sensitive, or they might close off, or they might not want, they might cut off the relationship. So I would say don't have any condescension. Minimize your assumptions about what this person needs. Take yourself out of that category. Take yourself out of the formula. View it as this is what a person's going through. What are all the variables that could affect this person acting the right way? The other thing is that even for our own selves, if we suspect someone is struggling with mental health issues, I think we should always generally be aware that many people around us are going through mental health difficulties. Okay? So it's not about pointing out the one odd person in the room. It's about how we generally carry ourselves and our general disposition towards everyone. Does that make sense? So if you, because sometimes this actually goes into the stigma side. If somebody says, hey, I'm depressed, one of the reasons why they might not want to say it is because other people might start treating them differently. I mean, I've heard this subhanAllah from people very upfront. Like, man, like I had a friend who opened up about depression that he was going through. And he actually posted something on social media. And he's not like a social media guy. He has like 100 followers, but he was going through a lot and he held it back for a really long time, and his family kind of like didn't hear him out. And it came out one day that he's like, hey, like he posted something on Instagram. He's like, hey, this is what I've been going through. I'm having a hard time with it, etc. He deleted it then afterwards. Now, of course, alhamdulillah, people reached out to him and like talked to him, etc. And I remember he talked to me about it, and he's like, I really regret what I did. And I was like, why? Because he's like, everybody keeps talking to me like I'm a child. Like they're dealing with me so delicately, because I said, but all he did was just share that he went through immense sadness. That's it. Does it mean that now you have to make this person feel so different about it? Especially if they've already brought it out to the open, right? And so I think it's important that if you suspect somebody's struggling with mental health issues, especially if they've come out about it, you don't want to make them feel too othered, too on the outs. You know, they're not going, because the way that he literally said it, he's like, I feel like everybody thinks I'm going to kill myself. That's really difficult, man. And it changes how people interact with them. And maybe it's not going to push them in the direction that you want. And so minimizing how much we think about this thing is so foreign, it's so weird. It's like a creature that infected his brain and who knows how he's going to act. And no, it's something that requires good treatment, but that good treatment is something that we should be defaulting to everybody anyway, right? That patience and the kindness that we show people. Sometimes we become more aware of it towards some people, but we should generally carry ourselves with the awareness that many people around us are going through it, even if they don't spell it out. Which one? The first one? Yeah. Okay, inshallah. So, yeah, I won't read the question. Okay, let me just read the question to myself a little bit more, because I read half of it only. So I'll pass it on to Dr. Ibrahim, and then I'll. Okay, so I'll just say this. My friend is struggling. The friend is having some troubles, and they view Islam as a prevention of happiness, a prevention of basically doing the things that they want to do, and that's making them want to leave Islam. What advice can I give? I mean, this is the Muslim American experience, alhamdulillah, right? It's having a difficulty of reconciling, practicing Islam with what we want. And in all honesty, I think I have a somewhat longish answer, and it's something I want to say earlier in the talk, but I didn't get to. So I think I'm going to let Dr. Ibrahim answer first and share some thoughts on this question, and then I'll go back to it, because I think it needs some unpacking.
If you have a flow, I can just speak after you. I mean, I don't mind. Go ahead.
Okay, just because I've handed the mic now multiple times, I don't think I should hand it.
Yeah. No,
So
go ahead. I'll talk.
I'm very aware that I'm hogging the mic. This is a problem with me in
no,
life.
that's fine.
So, may Allah forgive me.
Yeah.
Alhamdulillah. So when it comes to happiness and faith, we have to understand that, first of all, nobody should be shamed for the fact that they want to feel happy. This is how human beings function. Human beings generally default to wanting things that are comfortable, things that make them happy, things that give them positive emotions. When we frame Islam as, Islam is this struggle, it's difficult, etc., and you'll be happy in Jannah, so suck it up and deal with all of the difficulty in this life, not necessarily the best pitch all the time, right? Reality is, we do have in our faith a submission to Allah subhanahu wa ta'ala, where we decide that we believe that Allah subhanahu wa ta'ala's promise is what's best, and that we can suppress what our ego wants in this moment because there's going to be a greater source of happiness. But at the same time, if somebody's having a hard time seeing that Islam is going to be the best thing for us in the long term, sometimes it actually requires us having an unpacking of why it is that we're preferring something else in the short term, right? This is how the ego works, right? The ego wants to be satisfied now. The ego wants to be satisfied now. Give me what makes me happy right now. It's like the lowest form of happiness. And this like low form of happiness is something that's been discussed by thinkers far before Islam. Greek philosophers long had debates on what is real happiness and what will truly make you happy and what will truly make you content. Ultimately, the ultimate form of happiness we know is going to be in Jannah. That's real, full happiness. Everything else in the dunyawi sense, in the worldly sense, is going to be incomplete. Everything's going to be incomplete. So what we're trying to do is align our time in this world with something that will give us ultimate happiness. But in return, Allah subhanahu wa ta'ala does promise that He will give us hayatan tayyiban. That when we are trying to please Allah, Allah subhanahu wa ta'ala will give us goodness in this life. But if you have a doubt about Allah's promise, right? Like if theologically, there's a lack of conviction, a lack of understanding of Allah subhanahu wa ta'ala, then of course it's going to be very difficult to do the small things on the day-to-day. And you will only see it as a compromise on your happiness, not as a pursuit of a higher level of happiness. Now the reality is, human beings know this idea of delayed gratification. We see it every day. How many people here are pursuing medicine or know someone pursuing medicine? I want to see every single hand go up. Yeah. The whole idea is I'm going to go through hell for a few years, maybe a little bit more than a few years, but eventually it'll be worth it, right? I'm going to delay my gratification until I get a better payoff later, right? Islam is the greatest form of delayed gratification because you are delaying it because you believe with so much conviction that the best form of happiness will be in the akhirah. It makes it easier to frame the difficulties and challenges that you go through now. Oh, and then okay, bismillah.
Allahu Akbar, Allahu Akbar. Allahu Akbar, Allahu Akbar. أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمدا رسول الله أشهد أن محمدا رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله.
Bismillah. So if a person is having a difficulty seeing the long-term reward of what Jannah and paradise and pleasure of Allah subhanahu wa ta'ala will give them, rather than fixating maybe on the individual actions that you're trying to push them toward, it might be important to reframe their entire belief. Who is Allah subhanahu wa ta'ala and why is it that we believe in these things? Because otherwise, if you hammer out and convince them on each individual point, that's not going to give them what they're actually looking for. So sometimes looking beyond the complaint, right? So they're struggling with deen and mental health. Islam is preventing their happiness. What is it that's really going to make them happy, right? If they did this, if they did that, they'd be satisfying their lower self, the ego, short-term satisfaction. Is that really enough? And of course, of course, the answer to that is no. But breaking that down and actually going through the process of understanding the wisdom of Allah and belief in Allah and who Allah is, and knowing Rasulullah sallallahu alaihi wasallam, knowing the Quran, having that connection. When you don't have that as your frame of reference, everything else becomes more appealing because you're measuring everything just from a dunyawi sense. So there's a lot more to say, but I'll pass it along, inshallah.
You want me to?
Yeah.
Which
On
one?
which one? Touch on.
I want to touch on the first one just a little bit. Bismillah ar-Rahman ar-Rahim. Oh, sorry. That's all right. Okay. I'll say two things then. For the friends struggling, if you guys have a friend struggling with Islam and they're thinking of leaving the faith, be a sabil that they can return to the faith to more than anything else. SubhanAllah, most of us are not qualified to have some sort of religious debate with somebody. Make dua for them, sincere dua. And be somebody who is not seen as an antagonist. Be a good Muslim, be a good exemplar for them. But these aren't.
We're gonna do salah 8 times. There's still some time.
Okay, all right, good. I'll speak slower. I speak slowly. I'm a kind of a chill human being. I don't talk too fast. So, Bismillah ar-Rahman. The idea that we feel burdened to keep everybody around us or in our inner circle Muslim is good, right? It's the same thing about every Bani Adam. SubhanAllah, when we're on rotation, we see these people on drugs, and a lot of people look at them diminutively. These are all Ibn Adam, the people from impoverished communities on drugs, the people who are committing crimes, the people who get picked up, they spend half their time on the psych ward, half their time in prison. These are all our brothers and sisters. What you need to be in the Islamic society that you live in is a path that people can return to the deen to or through and have a hand that you can extend. Now, if somebody has a friend who's struggling with religion, it's probably been festering for a while. The question has things in it like forced to dress a certain way, controlling parents, gossiping, judging, strict cultural rules. So it's not just Islam. It's a host of things. But as soon as you set yourself up being on one side, you will inevitably become the antagonist, the enemy. So what's best is leave a path of communication open between you and your friend, make sincere dua, and inshallah, Allah give them hidayah. It's very difficult. And guard yourself. Guard yourself, more importantly, friends are important. You're important to you. Obviously. The second one is I need my parents not to invalidate when I express my feelings. ADHD, anxiety, depression. You're inventing things. You're trying to copy others. Yeah, that's loaded because what the context is very, very perplexing. Earlier we talked about the experiences that our parents had when they came to the United States, and it's difficult not to draw comparisons. My father's been in a prison. He's been basically a prisoner of war. He's lived in a tent. I think a faction of his family was killed. Like the context, subhanallah, I can't relate to my father at all, almost. And I grew up on Chicago's West Side. He can't relate to me, So subhanallah, the invalidation is terrible, right? Because you're like, what is it? If I grow up anywhere other than a war zone, I'm doing pretty well by his standards. And subhanallah, if you've got food to eat and you're going to school and you've got, if you can play video games, your standards are probably better than your parents ever were. So it's hard, right? So I think taking that into account when you feel invalidated and moving the perspective a little bit can help you cope with that. It's very hard to get people over the age of 30 to change, and if, assume your parents are probably older than 30, so it's hard to get people over the age of 50 to change. I think, subhanallah, we're commanded by Allah. So it's a divine commandment to be gentle with our parents, to not say oof, to not resist too much you know, as long as they're not interfering with your practice of the deen or in your life in a substantial way that can cause severe detriment, make dua for them. You know, they've gone through a lot. You're going through a lot too. I'm not going to invalidate the things that you're facing, but it may be difficult to rope them in on your journey to treat those things immediately. That's why when I was saying a little bit earlier, be careful who you open up to and how much you open up. Your parents ideally should be the ones that you can open up to, but sometimes you're not going to get the reciprocity that you want. Sometimes it's going to be a brother or a sister because none of us can really relate generationally. Things change far too fast. Inshallah. I think that's
Anything else?
Before we wrap up.
My question is that Islam has all solutions.
yeah.
So depression, you say there are so many aspects getting depression.
Yeah.
But in Islam,
Yeah.
it's a very, what you can say, clearly.
Yeah.
And how the Sahaba and how the Prophet, because we have an Iman on 17. One is that our fortune. What is going to happen is going to happen.
Qadar. Yeah.
It is from Allah.
Yeah. Subhanallah.
And the calamity came to Sahaba, they just tolerate because they said this life is very short.
Yeah.
Our purpose of coming in this world is just to please Allah, not to please anybody else.
Subhanallah.
But we have to follow the path of Prophet. Obey the commandment of Allah and follow the path of Prophet.
Subhanallah. I agree.
And we have a solution also.
Yeah.
That when you are in any calamity or any problems, Salah and Sabr will solve your problem.
Yeah.
Right?
Inshallah.
But today, the people are not practicing Islam. So to bring this community close toward Islam, we can solve not only depression, there are so many problems. So how we can solve that?
Yeah. Subhanallah. The fitan that we have, yeah. What he's saying is that Islam is a treatment for everything that we suffer from and that we're afflicted from, including depression and our psychological issues. But we have all of these problems that are permeating in our community. How can we bring the community together and solve the problems? I think I wish I had the actual answer, but subhanallah, the fitan that we have now, like in 2022, are different than the fitan I had when I was a teenager, and they're definitely different than the fitan you had when you were a teenager, subhanallah. So that's why we need to adapt the way, qadar, we believe in certain things, right? Those things might not be fully salient to the younger generation just quite yet. It takes a lot to be able to believe in things like that. And it's not to say that they don't have iman. It's simply to say that these are things that require time and practice and understanding. And because I didn't grow up with TikTok. I barely grew up with the internet, So in that context, my experience of life is extremely different, subhanAllah. So I think the adaptation of professionals, of brothers in the masjid, of doctors, of people who work with the community to the fitan that exist, and then being able to communicate with the younger generation not being too worried about coming to people like us in confidence, which alhamdulillah is happening more often. That'll solve these problems with time. That'll solve some of the problems with drugs that we're having, with people becoming murtaddeen, that are inevitabilities of living in a society like this. And this is nothing new, subhanallah. You remember when Spain was recaptured by, I don't remember when Spain was recaptured. Subhanallah, when the Muslims lost Spain, Muslims were tortured. There were fatwa to be able to marry non-Muslims, to be able to conceal your religion. And after a generation or two, the concept of what Islam is to a society that lives in a context under Western rule where Islam is under duress changes. And it needs to be adapted. In the Muslim world in the West right now, in the United States, we're not necessarily being oppressed by a government. We're not being oppressed by an institution, but the culture in and of itself. I mean, for example, we're all liberal to some degree as Muslims. We identify baseline as liberal or part of the Democratic Party. I don't mean liberal like culturally, but I mean part of the Democratic Party. That's how we've grown up, right? But the jargon is non-Islamic. So how do we separate that from that? That happens for 10, 20, 30 years. That's going to have an impact on the community. Those are the things that we need to be able to tease out and deal with. And we don't have the answers to that just yet. But inshallah, the idea of gatherings like this, of bringing people from different sides and different perspectives, whether they're clinicians, they're people that work within the community, is that we could see what the problems are, see what the genesis of the problems are, and inshallah provide some sort of treatment through an Islamically sound perspective. Like, I don't believe the way that I treat people violates any. I believe that my profession is from Islam, subhanallah. I actually believe the first psychiatrist was a Muslim, right? Al-Balkhi. So I have that perspective and I have that confidence in that context, inshallah.
I'll just give the last couple. So I'll keep mine very short. This will be my shortest answer of the night. Alhamdulillah. Somebody's cheering. The elderly wisdom that we often hear of Islam fixes everything. Islam is enough. As much as sometimes our youthful zeal will want to, well, there's nuance and there's this and there's that and there's that. At the end of the day, subhanAllah, I think, have you guys ever seen that like meme of like a person who is like early in the phase of something and they think something so complex, or they think something so simple, and then as they get more knowledge and time passes, they think it's so complicated, and then as they keep progressing, it goes back to the same simplicity that it started with. Not if you know what I'm referring to. Okay.
I don't know what you're referring to.
Yeah, this is it. This is internet culture. Youth, baby. So the idea is this: sometimes when you're early on in understanding something, you think it's very simple, and then as you learn a little bit, you think it's so complicated and there's so many details, and then as enough time progresses, you're like, dang, it really was simple all along. At the end of the day, we're going to pass. We don't know when. We're going to pass, and we're going to have a scale of deeds, right? And your good deeds will be weighed, and your bad deeds will be weighed, and then you'll either go to heaven or to hell. Just to keep it real simple. It's very simple. So keep trying to add deeds to your good scale of deeds. Right? And so that's one of the reasons why the older generation is Islam. Just keep praying. You're sad, keep praying. You're upset, keep praying. You're going through difficulty, keep praying. There's truth to that. There's a lot of significant truth. And the older that you get, the more that you see the wisdom in that simplicity. The first deed that you present to Allah subhanahu wa ta'ala, salah. So keep that in mind as we go into our salah.
I say this Amal Saleh is compulsory.
We gotta wrap it
Yes.
up, inshallah.
5 minutes.
So salah is
We gotta-
important, so we're going to go to salah.
Yeah. Jazakallah khairan to our speakers, Dr. Sablaban, for the Tareq, for this, mashallah, very amazing talk. We apologize for having to cut it short, for having to rush you guys, inshallah, but we have to pray salah. There's going to be refreshments right after salah, so come downstairs into the gym. We'll have some food, some desserts as well. So inshallah, Jazakallah khairan for participating. We're about to come upstairs.